Hi everyone, welcome back to another episode of Psych Talk. Today we're diving into the classification system that the DEA, Drug Enforcement Administration, uses to categorize drugs based on two main factors: their potential for abuse and their accepted medical use. The classification system helps to create guidelines that ensure the drugs that could potentially harm individuals are regulated while still allowing necessary medications to be accessible. So let's take a closer look at the 5 main schedules of drugs, starting with the most dangerous and moving to the least risky. The most dangerous is Schedule 1 and the least risky is Schedule 5. So Schedule 1 substances, as I said before, are considered the most dangerous, and they have no currently accepted medical use and have a high potential for abuse. These drugs are considered the most dangerous and most addictive, and you won't find these in a doctor's office. They are illegal for all purposes in the US, except for approved research under very controlled conditions. Some examples of Schedule 1 drugs include heroin, so this is an opioid, is highly addictive and has no accepted medical use in the US. Then we have LSD, which is a powerful hallucinogen with no medical use, but high potential for misuse. We have ecstasy, which is known for its use in party scenes, and this drug is also considered dangerous and has no medical use. Interestingly enough, in this category, we also have marijuana. Despite being legal in some states for medicinal or recreational use, it remains classified as Schedule 1 under federal law. And I think marijuana shouldn't be in Schedule 1 because I don't find it to be the most dangerous, neither the most addictive. But consider that this classification was made in the 70s and has not been updated yet. So yeah, maybe they will very soon. Another Schedule 1 drug is bath salts. I know, bath salts. So basically, they're considered synthetic stimulants that mimic drugs like methamphetamine and can cause dangerous effects such as aggression, hallucination, and even death. The thing is, their chemical structures can be easily modified to bypass legal controls, making them even more difficult to regulate. And so, yeah, there has been many cases in which bath salts cause individuals to experience harmful effects. Personally, I've never used bath salts, and I didn't even know this until I digged into this topic. So it's kind of concerning because many women especially are using bath salts to relax themselves, and maybe they don't know they're getting addicted to it, but who knows. Anyway, let's get into Schedule 2, which are medically accepted but still risky drugs. So again, Schedule 2 substances have medical uses, but they come with a high potential for abuse and addiction. These drugs are only available with a prescription from a doctor, and even then, they are tightly controlled. Examples include methadone, which is used for pain management and to help to treat opioid addiction, but can be highly addictive. We have OxyContin, a prescription painkiller that has been in the spotlight for its addictive properties. And we have Vicodin, a common painkiller that also carries a high risk for misuse and addiction. We also have morphine, codeine, what else? I already mentioned methadone. Oh, and fentanyl. Fentanyl is a Schedule 2 drug, which is interesting that they put it as a Schedule 2 drug when it should be a Schedule 1 drug, and marijuana shouldn't be in Schedule 1 drug. Anyway, I think fentanyl, it's highly addictive, highly deadly. There is no medical use for it, and so it should be in Schedule 1 drug, whereas marijuana should be, I think, a Schedule 4 or 5 drug. Well, let's get into Schedule 3, which is moderate risk for abuse. So again, drugs in this category are considered to have a lower potential for abuse compared to Schedule 1 and Schedule 2, but they can still be addictive. And these drugs are available by prescription, but they are less tightly controlled. Examples include ketamine, originally developed as an anesthetic, and it's also used for certain type of depression. We also have anabolic steroids, that these are sometimes prescribed to help with certain medical conditions, but they're often misused for bodybuilding purposes. And lastly, for Schedule 3 drugs, we have Suboxone, which is also a medication that is used for addiction treatment for opioid use disorder. And now we have Schedule 4, which is low risk for abuse. Schedule 4 drugs have a medical use and lower risk of abuse, and they can still lead, but they can still lead to addiction if they are misused. And these are still prescription medications, but they come with fewer restrictions than those in the higher schedules. Examples include Xanax, which is used for anxiety and panic disorders, but can lead to addiction if abused. We also have Valium, which is another medication used for anxiety that has relatively low risk for misuse compared to Schedule 2 drugs. Last but not least, we have Schedule 5, which is considered the least risky. Schedule 5 drugs are the least addictive and most often used for their medicinal properties with a very low risk for abuse. These can often be found in over-the-counter medications, though they may still require a prescription in some cases. Example could be Robitussin, which is a cough syrup that contains a small amount of codeine, which is a narcotic. And then we have Ezogabine, a drug used to treat a certain type of seizure. And so why do we have these classifications? Well, this scheduling system exists to help medical professionals, lawmakers, and the public understand how to handle each drug. Drugs that are high in abuse potential but have no medical use, like heroin, are tightly controlled. And others, like some painkillers, are available for medical use but require careful monitoring to prevent misuse. And the classification also helps law enforcement determine the severity of criminal offenses related to drug possession or distribution. So if you're caught with a Schedule 1 drug, the legal consequences are much more severe than a Schedule 5 drug. Obviously, again, as I said before, there are controversies and there should be a reclassification. So there are some drugs like marijuana that continue to spark debate. Even though there's growing evidence suggesting marijuana has medical benefits, it remains a Schedule 1 drug. And many argue that marijuana should be reclassified given its lower risk for abuse compared to drugs like heroin or fentanyl. And there's also the use of alcohol and tobacco, which are not classified under the CSA, despite their well-documented health risk. And some experts argue that if alcohol and tobacco were treated like controlled substances, they might be classified as Schedule 1 due to their potential for harm. And so understanding drug classifications is crucial for anyone who wants to understand how drugs are regulated and what risks they pose to individuals and society. And whether you're a healthcare professional, a lawmaker, or just someone that is curious about this topic, knowing what each schedule means can help you make more informed decisions. And so this is the end of the episode. I hope this helped clear up some of the confusion around drug scheduling and what it means for both medical use and public safety. And thank you for listening. Don't forget to follow us on Instagram. We're called Psych Talk Pod.